Hello, everyone in Social Work 668. We are currently in week 10 of the course. I'm going to take you through the course material for this week. So sit tight with me for a minute as I share my screen. Okay, so as you all know, this is Halloween week. So to stick with this theme, I'm trying to convince you all that it is not so scary. So after reading your blog on exciting things for this week, I realize that many of you are intimidated with statistical analysis and introducing Excel, which we will for next week to run some basic statistical analysis and learn how statistical modeling can really help us in our program evaluation. So I just want to reinforce that although it is Halloween week, it is not so scary, and I will walk you through every single step. So last week we turned in our logic models. I am still grading them, and in fact, I'm going to be grading them tonight, but I just wanted to let you know that I am so impressed with your work and the attention that you put into the logic model template, how you fit everything together, your narrative attached to it, and all your work will not be in vain because it's going to then lead us to really the next phase of the course, which is how do we measure change within organizations when we implement a program. So last week we had your blog on exciting things and other comments, and I just want to say thank you to so many of you who reached out. And what I really gathered from your blogs for this week is that many of you are stressed, many of you are exhausted, many feel like you have nothing left to give in this course and in this program, but just I want to encourage you all to sit tight, just stay with it. We're really just about 4 weeks out to being done with this semester. Many of you are so close to graduating, and just thank you all for reaching out to each other and supporting each other as well. We also focused on single systems and group research designs. The bulk of the assignments last week were actually embedded in the soft chalk lesson. So in session or / week 10, I am going to also post all of the answers to our soft chalk lesson so that you can really cross-check what you did in soft chalk to the actual answers, because there was a lot of, clicking through last week and making sure that you were answering the questions correctly. So this week, we are going to focus on a couple of things. The first is measurement tools and strategies for selecting the best evaluation measure for your project. So now that you have really hammered out what your program is going to look at, the next big decision that you need to make from a research design perspective is how are you going to measure change? What instruments, what surveys are you really going to use to understand how your clients, how your population of focus was acting, behaving, feeling, experiencing beforehand, and what were they doing after the implementation of your intervention. So there are so many different tools, so many different surveys, so many interesting, valid, and reliable measures that are out there free in the universe. So you really should start researching, looking for measurement tools that are on topic, that have been used with your population of focus in the past. So for example, you might not want to use a measurement tool that was developed for adolescents if your population of focus is older adults, even though it could be on the same topic, let's say stigma, for example. We next are then going to thoroughly review the soft chalk lesson for this week. There is a lot of information in there that's explained, and it's pretty in-depth, and there's also examples given on measurement. There is an essay question and a chapter review question, and these are both worth 2 points for this week. And lastly, we have a journal entry to discuss evaluation measures. I want you to be as specific as possible because this is where I get to give you detailed feedback on your selected measurement tool. I'm looking really for participation, not necessarily for accuracy in this assignment and your critical thinking. And I'm also available if you need any consultations this week on this assignment, because remember, everything builds one piece into the next. That's all building to your big last assignment for this class, which is our program evaluation assignment / proposal. So we're going to look at reliability and validity as concepts related to measurement. So when we think about reliability, what we really want to think about is consistency across time. So this is often called test-retest reliability. So think about having an apple. If I were to weigh my apple in the morning and then put it to the side for the day and then come back and weigh it in the evening, it should have the same weight on the scale that I'm using to measure it. That is called a reliable scale. And this should be across time and across different items, which is also known as internal consistency, meaning that there shouldn't be an item on the survey that sort of skews your results in a different direction. The things that you are trying to measure should all hang together on your survey. It should also be across researchers. So let's say I put the apple down in the morning, weigh it, and then my children come in the afternoon and weigh it again. It should also be the same weight. So when we think about reliability, we want to think of like exactly what we think about as a reliable friend. It's somebody who's always going to show up and always going to show up in a similar way. And the same thing happens when we're selecting measurement tools. We want to select a measurement tool that has reliability across test-retest, across internal consistency, and interrelator reliabilities, meaning that different people on our team can administer the same measurement and will come out the exact same way. We'll get the same results. So let's look at an example which shows a correlation between two sets of scores. So this specific example has to do with university students that were administered the Rosenberg self-esteem scale. And it was administered 2 times a week apart. So we're looking at Pearson's R. So we're looking at correlations here for these data. And the scale or the chart that I'm going to show you shows a positive 0.95. So in general, a test-retest correlation of positive 0.08 or greater is indicated of good reliability. So as you can see, time 1 is on the x-axis, score at time 2 is on the y-axis, and the times where there is just 1 dot, that means the person scored the exact same. And you can see it across the other dots that there's some space and some gaps. That means that it was not as consistent across times. But you can see that this pretty much hangs together very nicely, which means that they had pretty high correlation between score at time 1, score at time 2. So that's what we're talking about, reliability and consistency. So the next thing we're going to look at is what's called a split half correlation. So this involves splitting 2 items into 2 sets, such as the first and second halves, or even an odd number. So let's say you are administering a survey with 20 items. And let's say you're looking at even numbers and odd numbers and seeing if the correlations line up. So a score is then computed from each set of the items, and then the relationship between the 2 sets of scores is examined. So I'm going to show you an example that shows the same split half correlation with university student scores, same Rosenberg self-esteem scale. And for this, the Pearson's R for these data was 0.88. And a split half correlation of positive 0.8 or greater is considered to be good internal consistency. So again, we're going to be looking at a chart where there is good internal consistency. So x-axis, we're taking the score of the even items. Y-axis, we're looking at the score of the odd number items. And you can see that there still is good internal consistency between the odds and the evens. Next, we're going to look at a concept known as validity. So we often talk about validity and reliability together, but in fact, they are 2 very different concepts. So validity refers to how well an instrument measures what it is intended to measure. So in a survey that is measuring stigma should not really be measuring stress, for example, so that the instrument is designed to measure exactly what it is measuring. So there's 5 different major forms of validity, which we're going to go over. The first is face validity. So this is the most basic type of validity. It's also associated with the highest level of subjectivity because it's not based on any sort of scientific approach. It's just like us as a layperson looking over the survey and saying, yeah, these items seem to make sense. They seem to really all ask questions about the subject matter of stress, for example. Construct validity relates to the assessment of suitability of the measurement tool to measure the phenomenon that's being studied. So again, that has to do with my example of, a survey about stigma should not actually be measuring stress. If it is, that has very low construct validity. Third is known as criterion related validity. That involves a comparison of test results with the outcome. So this also has to do with what you are measuring to be true to that person's life experience. Let's say we're looking at a behavioral related outcome. So improvements in, let's say, alcohol consumption, if we're trying to introduce an intervention to reduce alcohol consumption. The criterion related validity would mean that the scale or the measurement that we are using should be true to the outcome, that that person is indeed lowering drinking, and that is matched to their score of the survey that they're taking. Formative validity refers to an assessment of effectiveness of the measure in terms of providing information that can be used to improve specific aspects of the phenomenon. So that is often used in, let's say, formative evaluations, which we'll talk about in a minute. And lastly is sampling validity. And this is similar to content validity, which might be a term that you've heard before, which ensures that the area of coverage of the measure within the research area is vast, so that you're just not measuring. If you think about a concept that is pretty vast, let's say we're looking at stigma. Stigma is a very multifaceted phenomenon. For example, if we're measuring stigma, we're going to look at enacted stigma, like discrimination, but we're also going to be looking at internalized stigma, or stigma that really is held within oneself. And these are two very different areas of content, but if we're looking at a stigma scale, it should really cover the multifaceted aspects of stigma, for example. Okay, so evaluation measures. Some of you at this point in the course might be interested in doing what's known as a process evaluation. Most students in the course choose to do what's known as an outcome evaluation, which I'm going to get to next. So a process evaluation is really important. And in most of the evaluations that I work on, we actually do a process evaluation and an outcome evaluation. Process evaluation is really about fidelity. We want to make sure that each step of the evaluation is being followed and that your population of focus is participating at high levels in it, so then we can truly measure the outcome. So we think about what things we can measure along the way of implementation of the evaluation. So process evaluation assesses how a program is developed and implemented and may investigate a program's structure and operations. Questions may include, how is my program being implemented? How is the research team and the implementation team working together to make this program happen? Under what conditions did the program work? Under what conditions did the program not work? Is the population of focus participating at levels which we intended? Because again, we're not going to be able to measure an outcome if our population of focus is not actually participating in the program. And then we're looking at questions like, can this program be replicated again across other programs? So other kinds of evaluation measures involve outcome evaluations. And I just want to be very clear that most students, like 99% of students that take this course, decide to do what's called an outcome evaluation, because most of my students are social workers and are interested in making improvements towards affect, behavior, learning, environmental conditions, changes in status, for example. So I'm assuming that most of you will go for an outcome evaluation. So you need to look at different ways to actually measure outcome. So outcome evaluations are a type of summative study that investigates whether changes occur in a particular program, or if they do, the extent to which changes can be attributed to the program. Because we know there's lots of threats, let's say, to involving external validity. COVID-19 pandemic is one of those threats. So these look at what the impact is of the program, to what extent the program is meeting its intended goals and objectives. And because we're looking at change is the name of the game, we need to collect data before implementing our before implementing our program and after in order to be able to evaluate it. So we tend to look at things like affect change. These are changes in attitudes toward a specific behavior. We look at behavior change. So we are very interested in the adoption of new behaviors, healthier behaviors. We look at learning change. So did my program actually provide educational materials that generated new knowledge and awareness? Environmental conditions. So did my program reduce barriers to healthier choices and lifestyles? So an example of an environmental condition could be the implementation of smoke-free policies, for example. And lastly, status change. So did this improve health outcomes or indicators? So next week, take a deep breath. I know a lot of you are very anxious about moving into our quantitative/statistical analysis that we're going to do. We are going to be using a basic program known as Excel. I know many of you have used it in the past, probably not to conduct statistical analysis, but mainly to just track things and organize things via spreadsheets. But do not worry. There'll be a lot of helpful tips. And as always, I'm here for you and we are going to get through this. And to just have a brief look ahead, your program evaluation is due fairly soon. It is due November 15th. I also want you to mark your calendars for an optional synchronous session, which I'm going to host on Monday, November 8th in the evening, Eastern Time, 7 to 8 p.m. to review and answer questions about the program evaluation assignment and presentation, which is going to be our final presentation, is actually going to be a presentation about your final paper. So by that point, you should just be able to kind of look at what you've written in your paper, transfer it to a PowerPoint presentation, and record yourself doing the final presentation. I will also record our optional synchronous session so that any of you can access it if you are not able to attend. And lastly, I'd like to leave you with an affirmation about motivation, because many of you spoke about just having really low energy, really low drive at this point in the semester across all your courses. So motivation comes easily because I take steps to keep it strong. Today, I know I can stay motivated to continue working towards my goals, which is graduating with your MSSW very, very soon. My motivation invigorates me. I feel strong as I renew my efforts to keep living my dreams. So with that being said, I hope you all have a fantastic week 10, and I will be getting back to you very, very shortly with your logic model and my grades and comments. Take care, everyone. Bye.